join us today for what we know will be it's certainly a timely talk about impactful research. We're really thrilled to have joining us virtually. We wish we could do this in person, but virtually, Dr. Gilberto Lopez. And I'll tell you a little bit more about his background and we'll let him talk. I just want to start off by, first of all, although we're virtual, by acknowledging where our institution, the University of Arizona, is located. We respectfully acknowledge the University of Arizona is on the land and territories of Indigenous peoples. Today, Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education, offerings, partnerships, and community service. And that is the official land acknowledgement of the University of Arizona that was developed in partnership with tribal representatives. Here at the Francis McClelland Institute, and for those of you who are unfamiliar with us, our goal is to build family and community resilience through the power of research, with the ultimate goal of improving the lives of children, youth, and families from disadvantaged backgrounds. We do this by supporting innovative research, by actively partnering with community organizations, by sharing research findings with practitioners and the community, and by educating the next generation of engaged scholars and leaders. The work we do is to honor the legacy of Francis McClelland, who lived a life that exemplified, celebrated, and amplified resilience. We also would like to thank another alum who's made important contributions to Francis McClelland Institute, to the Norton School of Family and Consumer Sciences, as well as the University of Arizona, and that's Pam Turbeville, for whom this speaker series is named. So thank you to Pam. And finally, without further ado, we're really excited to have Dr. Lopez joining us today. Dr. Gilberto Lopez is an assistant professor in the School of Transborder Studies at Arizona State University. He has advanced degrees in public health from Harvard and from Johns Hopkins. He is the director of COVID Latino, the COVID Latino project, which combines the arts and social health sciences to create culturally tailored COVID-19 information for Latinx populations. His work uses social determinants and political economy of health frameworks to understand the health and well-being of disenfranchised populations. Dr. Lopez's ultimate goal is to produce data that will guide the development and implementation of interventions that reduce social inequities. I am about to hand this over. I apologize, it sounds like my audio is going in and out. I apologize, hopefully that's only on my end, and this won't be a factor once I turn it over to the main reason that you came today. I am about to turn over the slides to Dr. Lopez. I do ask you, if you have any questions, you can put them in the Q&A portal. We will save those for the end. We'll also be happy to allow you to unmute yourselves and ask those questions. I'm really hoping that we can overcome the Zoom webinar format and have a lively discussion about this important topic at the end of the presentation. So thank you so much, and I will now turn it over to Dr. Lopez.
Okay. Hi, everybody. Thank you. Again, my name is Gilberto Lopez, assistant professor at the School of Transborder Studies. As I speak, feel free to use the chat. If you have any questions, I'll try to answer them. I'll try to be mindful of keeping an eye on the chat. If not, then I'll field any questions towards the end, like it was stated. So I want to talk today about a project that came about out of frustration. Personal thing is I am from a farm working immigrant community in Central California. And being back home when the lockdown happened, I was frustrated that the information about COVID, what to expect, how to protect yourself, the best practices, social distancing, wearing a mask, all this information that most of us, I think most of us here in this room kind of took for granted, took it as obvious information. That information was not coming through to the Latino and immigrant farm working communities that I'm from. And I was frustrated. And coming from institutions like Harvard, Johns Hopkins, the peers, my collaborators, my people that I went to school with, or other academics, they were getting very good information. And us who do social determinants of health research knew that this is not going to end well. It's not going to end well, information being one of them. So what I decided to do is launch this campaign, this project. And I'll talk about this, advance the slides, about how this came about. And I'll talk a little bit about COVID-19 disparities in general, how they affect Latino, Latinx communities. I'll talk about the data that we collected. We launched a couple of studies, the CASA COVID studies, and then how that informed the COVID Latino campaign that we launched to get the information back out to the community. So a little bit about COVID-19 disparities and the inequities and how it's disproportionately affecting some populations more than others. Here's a chart, just to put COVID in context. And this has changed. This is really outdated. This is as of September of last year. But there are these points in history when death is kind of concentrated in very short, very short span of time. And it's usually in wartime and when you have pandemics that hit populations. And here now COVID-19 has been the event with the most death in the history of the United States in such a short period of time. Now it's over 800. It's more than the 1918 pandemic. It's more than World War II, World War I, Vietnam conflict, Korean War, almost all the wars we've had here put together. More people have died of COVID-19 in this country than all the wars put together that we see here. So again, this is such a big event that's occurring. And sometimes that gets lost. That message gets lost in a lot of the back and forth that we see, that we hear on social media or on popular media. But maybe 100 years from now, we're going to look back and see how big of an event, how big of a disaster this was. However, this distribution of death is not equal across the country. Certain groups, certain populations are disproportionately affected. Here's data from last year as well. We had, again, 660 excess. Now it's over 800. Much of that is COVID-19 related. But the story here is race ethnicity matters for health. We see that the Latino Hispanic population had over 50% excess death during this time compared to these other groups. However, within the Latino Hispanic community, it also matters, kind of context matters. The type of Hispanic or Latino, your heritage matters, where you're coming from, the type of immigrant you are, all that context matters for who is more vulnerable to this pandemic. And we saw here that Central American born, they had almost a 50% more excess death during this time, and Mexican born, and then you had US born. So again, it's not hitting all the US equally. Different populations are disproportionately getting hit, with Hispanic or Latino being the hardest hit. And within Hispanic or Latino, again, context matters, history matters, so where you come from, where your population comes from, where you work, which I'll talk about in a bit. All that context matters into who gets affected and who's more prone than other groups. Here, a little bit of data about morbidity and mortality. Morbidity being how sick you get or who's more likely to get infected. Black and Latinx populations at the beginning through last year, they were at 3 times the risk of infection. And we saw an increase in emergency department visits for these two populations compared to white Americans. Within the Latinx population, those between 40 and 59 years of age were 5 times the infection rate than other groups. So that, again, they're more likely, we saw more infections in Black and Latinx communities. Mortality, kind of similar story. Black and African Americans had on average, had a rate of 106 death per 100,000, followed by Hispanic and in the other groups here. The one thing to look into here is this, sorry, go back, this 25%. 25% of death in the Latinx community was among those 60 years of age or younger. So that is compared to only 6% of whites. This is important. Again, context matters. Why is it that that such a high 1/4 of death compared to 6% is in those that are younger, under 60 years of age? Or why is that? What is accounting for that? And then another data here, another data point that came out, of last year, on average, the U.S. life expectancy dropped by 1.5 years. On average, people are going to live 1.5 years less because of the pandemic. Again, this is at a population level. But this is different for Hispanic men. Latino men lost on average almost 4 years of life during this pandemic. So why is it that Hispanic men are living less on average compared to the overall population? Why are they disproportionately being affected? Some of the answers we have, my research looks at social determinants of health, and I try to understand the context. This idea of where we sleep, where we work, and where we play matters for people's health, their vulnerability to certain diseases, in this case, to a virus. So we saw that within the Latinx community, Latino community, we see that there's issues of healthcare access and utilization. One of them being immigration status. So this idea of public charge, if you're waiting for your court hearing to know if you're going to get approved to stay in the US or not, having a family member in the household who's waiting for an immigration case, this idea of public charge, getting any kind of help whatsoever, whether it's testing, getting vaccinated, any kind of service from the government, there is this fear that that's going to be seen as a public charge, and that's going to disqualify you from any kind of legal, getting any kind of legal approval to be in this country. The other one, insurance. We know that Latinos and Hispanic have the lowest rates, among the lowest rates of health insurance, not having health insurance. And the other one is knowledge of services or programs, just not knowing what's there, what's available with regards to COVID, not knowing where to get tested, how to get tested, what paperwork are they asking if I go get tested. So these things kind of prevented some of these individuals from seeking proper care with the pandemic. Occupation and housing, which are very strongly correlated. Where you live or where you work, to some extent, dictates where you live. We know that the Latinx community is more likely to work in these essential jobs compared to whites, 43 to 25%. And we know as well across the world, immigrants are disproportionately coming into these, what they call the 3D jobs, jobs that are dangerous, demanding, and dirty. These type of jobs, degrading as well, dangerous, dirty, degrading jobs that immigrants tend to fall in. They're low pay. If we're looking at COVID, very low protection, no PPE, impossible to work from home in a lot of these jobs, construction, service industry, hotel industry, restaurants. These jobs, it's impossible to work from home. So you have the disproportionate amount of certain populations working these jobs, and where you physically are more prone to be in touch with this virus or be in contact with the virus in these places. Where you work, low paid jobs dictates where you live. What neighborhoods do you live? You're going to live in neighborhoods where you have high rates of poverty. You have crowded conditions, multi-generational homes, where you have the grandparents, the parents, and the children living under the same roof, or living in crowded apartment complexes, places where it's impossible to socially distance. And if someone were to get sick, not having the resources to have them isolate in a hotel or somewhere else, all this kind of plays into the disproportionate rates of infection among these populations. And then here we also have the social cultural. We have language barriers, and we have the racialization and marginalization of immigrants, and specifically within the Latino community or immigrants from Latin America, indigenous peoples coming from Latin America, which is a growing number of immigrants whose primary language might not even be Spanish. or English. Primary language is another indigenous language, Mixteco, Zapoteco, one of the Mayan languages that are growing here in the United States. So language barriers and the racism that comes with these identities that further marginalizes certain populations. So these are some of the reasons, some of the explanations of why these unequal distributions of the virus is affecting some groups more than the others. And then we also have misinformation or disinformation. A report came out, Nielsen put this out late last year, showing that that Latinos are more likely to consume and share misinformation online. We're very active. It's a very active community that uses these social networks to communicate transnationally as well as within national communities. So there's this exchange, this flow of ideas happening on these social media platforms. And this study showed that with the Latino community, they're more likely to consume and share a lot of the misinformation about COVID. So what we did, we launched the Casa COVID studies, and we wanted to collect data. We wanted to understand attitudes, behaviors, and perceptions of COVID in Latinx communities. So we did a mixed methods study. We did in-depth interviews. We did surveys as well. We started by interviewing 60 Latinos across California, Central Valley, and across Arizona. And we wanted to, again, assess the beliefs and behaviors. What are they saying? How are they making sense of the pandemic, of the virus, of treatment, of testing? What are the discussions? Where do they get their information? So we wanted to understand that, the whole context of how they navigate and how they decide whether or not to seek treatment, to seek tests or vaccinations. And we also did a quantitative study, and we followed 600 individuals from California and Arizona in 2 waves. We did one wave in 2020, and then the second wave this past year. And this, asking questions again about, do you adhere to these safe practices to protect yourself, wearing a mask, washing your hands, staying 6 feet apart? Where do you get your information? We asked many of these questions, again, to get a quantitative understanding of who does what, how, and when with regards to COVID. We focused on a couple of things here: psychosocial and socioeconomic effects of COVID. We want to understand how COVID is affecting individual psychosocial well-being, depression, anxiety, and these type of measures that we have, as well as socioeconomic effects. Are people's employment being affected by the pandemic? And then beliefs, attitudes, and behaviors, and information sources. Where are they getting their information? So I'm just going to really breeze over some of these preliminary findings. There's many more that we're still analyzing and that we've looked at. I'm just showing this as an example, how we're going to use the data. We collected the data, we analyzed it, and then we use some of this data to inform the artwork and the animation that I'll show you in a minute. So one question that we ask is, if a vaccine for COVID-19 were available, this was before the vaccines were available, what is the likelihood that you would get vaccinated? So we asked that question. Another of the questions we asked was, what is the primary language? What is the language spoken in your house? We have Spanish only, we have bilingual, Spanish and English, and we have English only. So this analysis here is done by language in the household. So what we found is that there's something going on here with language and being more likely, or saying that you're more likely to get vaccinated. Those who are only Spanish speakers, those households, those individuals who live in a household that are only Spanish speaker, were only at 58% said that they're likely to get vaccinated, compared to bilingual, which is higher at 64, and English even higher at 74. So the question is, what is this? Why is language kind of predicting likelihood of saying that you will get vaccinated? What is it? What is language a proxy for? It's the question that we are asking with the data. Another question, similar question that we asked was, have you tried getting tested for the virus? And we see here the pie chart, the round one, The light color is those who did try. So of those households who were Spanish speaking or only spoke Spanish, 33% said yes, they tried to get tested. You see a higher number here with bilingual households. 43% said they did try to get tested. And over half English speakers said that yes, they tried to get tested. So again, there's something going on here. Language is somewhat associated with even attempting to get tested. Even more interesting here is in the green, the bar. Of those who try to get tested, how many were successful in actually getting a test? So some people tried and they were not successful for many reasons. And that's what we're trying to understand. With Spanish speakers, only 30% of those who try to get tested were able to get a test. Bilingual, you had 89%, and English speakers, 50%. So the two questions here is why are Spanish speakers less likely than bilingual speakers to seek testing, who are themselves less likely than English speakers? And why is it that Spanish speakers are much less likely to successfully get a test compared to these two? And the other question is, why are bilingual, why is it at 89% compared to 50%? So we're trying to understand, what's going on here. But the overall story in here is that language is related or allows us to kind of predict, attempt to get tested or likelihood of even wanting to get tested or getting a vaccine. So that's the quantitative. We in some of the interviews we did, we asked, reason to test. Why do you test? Why do you not test? These are some of the reasons people put out there. People don't test because they, especially the younger ones, this idea of invulnerability, perception of low risk, lack of symptoms. No one in the household had symptoms. So this is some of the reasons people don't test. They just don't see the disease. They don't see any of the symptoms. So why would I test if I don't feel sick? So it's interesting because this notion of preclinical disease, preclinical infection, it seems to not fully be there in some of these answers that we got. This idea that you don't have to have symptoms in order to actually have the virus and be able to transmit the virus was not there. In this case, to be sick is to have symptoms to physically manifest the virus in ways that we could see outside of a microscope or outside of a clinic. Reasons to test, recent travel. People had said, I just traveled and so we tested. The number one reason when we did these interviews was someone in the household or somebody that they came in contact with tested positive. So one example that I think about in some of these interviews, someone said, yeah, we had a barbecue over the weekend. A few days later, so-and-so, someone who was at the barbecue called us, told us that they tested positive. So now we are going to test here in the household. We tested because someone tested positive. The other reason is they work in places where they were required to get tested, or before going to the hospital. At this time, going into a clinic or a hospital, you had to get a test before you were able to go get any kind of medical procedure. So these are the reasons people tested, reasons not to test. So what we did, let me see the chat. If there's any questions I could answer now. Okay. So what we did, we created this campaign, COVID Latino. So we have all this data, and the philosophy that I have and that's been driving this campaign is we're going to prioritize the community before the academy. Instead of using that data to publish manuscripts and to kind of advance my own professional career in that regard, because in the academy it's all about publishing, it's more important to prioritize the community, use this information, use this data to put it to use in the community, to give it back to the community. So we figured out, how do we do that? What's the best way to do that? We came up with this COVID Latino campaign, which is essentially getting this needlessly complex information, medical information, and changing it and packaging it in a way that's very accessible to the Latino communities, culturally tailored ways. So we officially launched on April 20th of last year. That's when we had the social media push and the launch. Although some of this artwork has been going on even in the fall of 2020. But the official launch of the campaign was April 20th. And there's many different components. The main thing that we're kind of known for, the main focus that we have is animation. Short 1 minute, 2 minute explainer videos that use characters, that use the language that resonates with the community. So we started with this, we create a cast of characters. Each one has kind of their own identity, their own persona. In this case, Uncle Rigo, he's a skeptic. He believes he's being tracked. He doesn't want to get tested. He doesn't want to get the vaccine. Mama Lucha here, she's like the grandma, the loving character who's there to care for everybody. And the doctor, the physician here, who's the one who tells us, gives us the information, the accurate information. And we always have a villain. So here, the coronavirus is the villain here. So let me show you a couple of animations. One thing to note, these animations are in Spanish, they're in English. Most of them are in Zapoteco, which is a native language, indigenous language from Mexico. We're trying and we're working on getting them in other languages, especially indigenous language from Latin America, from immigrants from indigenous communities from Latin America. So let me show you this one, then I'll show you another one.
They are going to chip you with the vaccine. They will follow you. They will track everything you do. Look, I'm so upset about this. My temperature is 102 degrees.
Oh, Terrible. There are no chips in the vaccine. Stop spreading false information on social media. If our community doesn't take the vaccine, then the virus will bounce from body to body, creating new mutations, which may become resistant to the vaccines. That's why everybody needs to take the vaccine. It trains your immune system to fight the virus. The vaccine contains something that looks like part of the virus, but it's not the virus itself. Our bodies learn to recognize it and learn how to fight it. These help our body make something called antibodies that can attack and kill the real virus before it starts to spread. So make sure you go and get vaccinated. Rigo, the doctor is right. Stop spreading nonsense. Nobody wants to track you. And if they did, you put everything on the internet already. Put that thing away and come have some frijolitos con nopales.
So let me show you a second one, then I'll talk a little bit about what went into these animations. This one's in Spanish here.
Les habla su capitán, soy la Buen Rostro. Gracias por volar con nosotros. Estaremos despegando en unos momentos.
Algunos aspectos a tener en cuenta mientras se abrochan los cinturones de seguridad. Aunque la gente ha reanudado los viajes, todavía tenemos que ser cautelosos, especialmente a nivel internacional. Sobrevolaremos países en los que las tasas de COVID todavía son altas y las tasas de vacunación siguen siendo bajas. Es importante, por amor a nuestros familiares, evitar los viajes en la medida de lo posible. Pero si tienes que hacerlo, asegúrate de vacunarte. Y recuerda que, aunque esté vacunado, puede poner en riesgo a las personas al celebrar grandes reuniones. Así que hazlo simple, hazlo pequeño. ¿Quieres asegurarte de que todo el mundo esté allí para la próxima reunión?
So what we did there, those two animations, the first one of the themes that was coming up in a lot of the interviews with men specifically, or not just men, but a lot of the immigrant communities, was this fear of I don't want to get the vaccine because they're going to chip me. This fear of a chip. that they're going to put a chip in you to track you, that the government wants your information to know where you're at. So instead of kind of ridiculing that belief, we try to work within that perception. It's a very real perception. And if you just look at the history of the United States and immigration and immigrants, there is a history that, you know, the US, not just the US, countries all over the world are actively or have actively trying to track down certain populations, specifically immigrants, and locate them and get them out of the countries. So that is the true fear. That's a fear founded in history. So instead of ridiculing it, we try to kind of understand the context of that fear. So that's what that first animation is about. Trying to talk about, you know, the importance of the vaccine and what the vaccine does and how it protects, but also playing within the framework, that ideology of that fear of why people don't want to get the vaccine. The second animation there is about travel. We created this one when, especially from US and Latin America, and Mexico specifically, during the holiday season, where a lot of people were going back to their communities. And the message we're trying to get is, first, try to avoid going back to the community. If you don't, at least wear a mask, protect yourself, get vaccinated. And then try to put the knowledge out there that we have access to vaccines here in the US. Even though there's huge inequity of who has access and who doesn't have more access, overall, as a country, we have access to vaccines compared to other countries, specifically Latin America, where they're still struggling to get the first dose, the first vaccine in a lot of these communities. So you have us going back to other countries, being the most infected country in the world, going back and causing harm to these communities that have very limited protection. So that's what the second message was about, going back and protecting yourself and kind of bring awareness of it's not just about you, you're going to bring it to the community. So, you know, try to avoid it or protect yourself. The second thing we did here as part of this campaign is infographics. So this is an example of an infographic that was done by the NIH or CDC created this. You know, this is like any infographic that you see at a clinic that you walk by. So we're trying to figure out, how do we make this more culturally accessible? This is something that most of us probably will see at a clinic, don't even look at, you know, won't even turn twice. So we work with local artists in the Phoenix area, and then we created these. It's the same information using kind of cultural iconography. In this case, these are cards from the game of Loteria, what some people will call Mexican bingo, or something similar to bingo, which is the Mexican cultural game that's very common. So we use cards. The rationale here is it's the exact same information that this has here, just used in a different way. And the idea behind it is, if you see this anywhere, you know, if it's in a clinic, if it's in a supermarket, wherever we were to put these, if you're going to walk by these, you'll take a double take. You might not read all the information, but at least you're going to take a double take versus this. You kind of know it's something clinical. This will make you look twice because it resonates. You know, kind of what this image is. You know, it doesn't look quite right. It doesn't quite look like a Loteria card, but it is a Loteria card. What is it? So people are going to stop and look at it. Again, they might not read it, but at least it's more likely to stop and look at this compared to the other one. The other thing we did, so those are infographics, ways of visualizing information. We also use art and cultural expressions and cultural kind of iconography that resonates with some of the communities here, specifically in the Southwest. We worked with another artist here in the Phoenix area, and who drew these. You know, the one on the left is Vicente Fernandez, kind of a well-known Mexican singer who passed away 2 months ago, kind of appealing to this masculine identity and normalizing the vaccine to some extent. On the right, you have the Virgen de Guadalupe, which is one of the patron saints, or the Virgin of the Americas. Again, more of a maternal kind of a theme going on here. Again, protection, being protected and normalizing the vaccines. Then we also use the same artist, also did some work using historical figures. You have on the left, the Adelitas, the soldiers from the Mexican Revolution. And instead of rifles, they have the syringe. And then on the right, you have some pre-colonial warriors and protectors of community as well. So that's kind of the artwork. And then just to end here, we also collaborated with Lalo Alcaraz. Lalo Alcaraz is known for his work on Coco, the movie. He's got shows on Fox. He's syndicated on, I believe, the LA Times. He's been doing cartoons, political cartoons for almost 30 years or so. So we collaborated with him. We invited him to ASU. And out of this collaboration came a series of cartoons that he did for us or with us on different topics. The one on the left, this came at the time where a lot of governments were giving lottery prizes. They had tuition, they had $1 million, cars. They were giving away all these things. So the message here is, even if you don't win the $1 million, there's other things you could win by getting vaccinated, reunited with loved ones, food, going out to eat, health, all these things here. Again, the iconography here, this is from the Mexican game of Loteria. These characters, anybody who's ever played the game or knows anything about the game, you can see these characters and you know exactly who they are. Although they have, the kind of the Lalo characteristics, the Lalo colors. On the right here, we wanted to do something for farm workers in the Central Valley. Is the breadbasket of the United States. It depends. The industry depends. The economy depends on agriculture. And here we wanted again highlight this. We need to vaccinate our essential workers. Nothing more essential than the food supply that we have. So we got to make sure that our farm workers are vaccinated. So he did something here with farm worker. Here I'm just going to show quickly some of the other ones. People didn't want to get vaccinated because it was too dangerous, yet we do all these other behaviors that are more dangerous. The one in the middle, there was a time there when, especially the younger individuals, didn't want to get vaccinated unless it was the Pfizer. It was this, the cool one, the bougie vaccine to use with Pfizer. So people were waiting for that. So here is the message, this person waited too long for the Pfizer and got infected. Again, the idea of infertility, using again comedy and critique, cultural critiques to show that some of these beliefs are really unfounded on science. Herd immunity, that is a concept that in most of our messages we're trying to get through, trying to get across. What is herd immunity? It's something that's not as easy to understand as many of us think. Sometimes it just doesn't make sense to a lot of us. So how do we make the idea of herd immunity, how important herd immunity is, and what the role of vaccines are in creating herd immunity? So we try to do that in some of this. And again, touching on pregnancy and on the youth again. Here's more using, again, try to get the idea of herd immunity using some of his famous characters, the Lucha Libre characters. And again, protecting the family. How does getting vaccinated, it's not just for you, it's for your community. And here's more of that. More of this one. Delta came out, the one on the right. This one really resonated with a lot of people because everybody knows this individual who has a cousin who's a really tough guy. So we have COVID, he's bringing his cousin Delta. It's the tough guy, he's tougher than anybody else. So and now we have Omicron. So this is when Delta came out. So again, using the arts, using cartoons to get the message out there and try to address some of this misinformation that's out there. I want to end here. This is the newest collaboration we have with Lalo Alcaraz. It's a cartoon. He created, he's the creator of the characters and kind of the motifs that are here. This one's more so for kind of the Mexican American Chicano populations. But let me play it and then I'll close this talk.
Tú
Super Vaccine Vato headquarters, they state your emergency homes.
Tío Rico is outside, unvaccinated, and he's trying to come to our party. We need Super Vaccine Vato.
Come out their way. Super Vaccine Vato wrapping up another emergency, fool. He'll be there in a few minutes, homegirl. What's up, Super Vaccine Vato? We have an unvaccinated emergency situation at Doña Maria's door.
Orderly. Super vaccine Vato and rule out. Listen up, Holmes. This is a vaccinated neighborhood. Turn around or you're gonna get shot. Why are you talking, Doña Maria? You're not vaccinated, ese.
I don't believe in the vaccine, but they're all vaccinated. So what's the harm?
Delta. You know Delta, right?
Nah, I don't trust airlines.
Delta is a new variant of La Rona. It can harm our abuelas and the OGs, even the vaccinated.
Pues that's why the vaccines are a fraud. I'm better off without them.
First thing, it ain't about you, Holmes. Vaccines are all about us.
So again, that animation is kind of for different demographic of Latino, Latinx communities, but the message is the same. We want to have characters that look like us, talk like us, think like us, getting the message out there. This is different than what CDC is putting out there for the Latino community. So we want to either complement that or bring in a different approach that really resonates with individuals. In all of these, the characters, we all know, everybody in the Latino community, or a lot of people in the Latino community know someone like Uncle Rigo, know someone like each of these characters. They resonate and they feel, it's us. We see ourselves, we see our identities being respected, using comedy. We use comedy because we feel is more effective than using just a serious tone. We do have one animation, I won't show it here, that it's more serious. It's on mental health and children. So it's a darker kind of animation, it's more serious, but overall, most of these are using laughter, using comedy to some extent to get information out there. So next steps, that's where we're at with this campaign. Currently, we're evaluating. We want to make sure, we want to test that these actually first resonate with the community the way we hope for. And we're seeing, yes, these resonate. People like these animations. But also, are they actually bringing in new knowledge? Are they really informing the people with the message that we want? We have some studies that are going on, but we're seeing that, yes, people are learning after watching these animations. They learn more than the status quo. And then the second thing we want to do is scale it up. We need to reach more individuals, more communities. The message that we say, we tell everybody, is this pandemic is not going away soon. We always, we have for the last 2 years, oh, there's light at the end of the tunnel, but yeah, there's a new mutation, a new variant coming through. This is not going to end anytime soon, especially for the Latinx communities who have we have very strong ties with Latin America, and Latin America vaccination rates are very low compared to other places. So this pandemic is not going away soon. So we need to scale this up. We need to make sure that these messages are being done in other cultural contexts. We would love to do it in more the East Coast Latino communities, the Dominican, the Caribbean Latinos, the maybe even South American Latinos from South America, who have different expressions and different things that they make fun of, different ways of laughing, or different things that they laugh at. So we would like to cater those for different populations. And then the last one here is collaborations. This project is not just me and ASU and my unit. It's a collaboration of students from across many universities, Arizona State, University of California, Merced, who have been collaborators with us from the beginning. We have individuals from Harvard University. Now we have some Duke University. We have collaborators at UNC, various UCs across California. So it's a collaboration in addition to community organizations. In California, it's an organization Cultiva la Salud, who has been partnering with us from the beginning. In Arizona, AZ Chow, we had individuals from AZ Chow, was a community health workers organization, who were part of our advisory board here. So it's a very interdisciplinary, a very collaborative kind of approach of individuals who are really passionate about social change, who are fed up with the status quo and want to do something about this. So, and we want to continue these collaborations, grow these collaborations. So I'll end there for the sake of time. I'll open it up for questions. If anybody has any questions, we'll take questions now. Thank you all.
Thank you so much for this really powerful and inspirational presentation. And I would encourage you all, if you have questions, you can put them in the chat. You can go ahead and enter them in the Q&A. You can raise your hand, and I see there's someone raising their hand now, and we can try to allow you to speak if you'd like to be unmuted.
I think Norma has her hand up.
Yes, may I speak?
Yes, Norma.
It's so good to see you, Dr. Lopez. I just have to brag on you. I'm with the University of North Carolina, an NIH project, NCCL, and we've collaborated with Dr. Lopez's group from about April or May of last year, help fund some of those animations. And one of the things that we did a step beyond the animation was to create comicas, fotonovelas of the animations, which are passed out at events with the community. So if we're in a farm worker camp, if the farm workers that are coming in February and March to do our work here in North Carolina, they all go to one city. We make sure they have a copy of these animations to look at, and we talk to them about it, as well as obviously offer vaccination, et cetera. So they have been so well received in North Carolina. And again, our population is mixed. I mean, we have Dominicano, Puerto Riqueño, and mostly Central and Mexican Americans. Pero it resonates with all of us. I mean, we all see ourselves in the characters one way or another. So I have to applaud the work that you all have started, and I'm hoping that we can find a way to continue highlighting, as you said, the other, the Eastern coast, the Caribbean coast, the Caribbean folk, but it's been amazing work, and thank you.
Yeah, no, thank you, Norma. Norma, been a collaborator with us, and it's been great working with everybody at North Carolina. So thank you. There's a question on here about these animations. So one thing I did not mention is the reason we make these is to give them away. We want to give them away. They're for the community. So if anybody here is from a community organization, or anybody wants access to these, we are currently working on creating a media kind of a pamphlet with the links on how to download these animations. You'll be able to download them and use them however you like to use them, as long as you don't edit, modify any of them. The alternative is we have social media accounts. Go to covidlatino.org. The website is a little primitive, but we're working on it. But the social media links are on there. We have YouTube, we have Twitter, Facebook, almost the major social media accounts. We are sharing our content, and we're going to continue to share our content there, so you could reshare that and use it there. But if you wanted access to these files, you could email me, and we'll be happy to put you on the listserv. When the package is ready, the media package is ready, we'll send it out, and you'll be able to access all of these animations. We have over 20 of them so far, and we hope to create more.
Any other questions? Yes. Yes, so messages of gratitude, really critically important work that's clearly in service of communities.
Yeah, no, thank you all, and thank you for having me here. And there's a question about the slides. I don't know if the slides will be made available, but I don't know if you have a way of doing that, or this recording. There's a question on there about this.
Yes, yeah, we're happy to share the slides. If that's okay with you, we can share them with the people who've registered. We have emails from Zoom if you've registered for Zoom for the webinar today using an email address. We also will be posting the recording of this talk sometime early next week to our website as well as to our YouTube page. And once you do, you know, we're also happy to share the links that you'll be providing. If we would, can we please share those? This is exactly the kind of information that we want to get out there so people can really use it and it can actually make a difference.
Yeah, of course. Once in a week or so, like probably next week, we'll have the media flyers ready to disseminate. So we'll send them out to individuals once they're ready.
Fantastic.
Yeah.
Any other? Looks like the other chat messages were, yeah, expressions of gratitude. Anyone else? All right, well, so thank you so much, Dr. Lopez. This was just really inspirational, and I do hope that we can, when we reach, you make a good point, the pandemic is going to keep on going. But when we reach a safer stage, we can have you to have some of these conversations in person. Come down and meet with us. We would love to continue these conversations. Thank you, everyone, for joining. And like I said, we will have the link to the video up on our website and on our YouTube channel. Please share it with others. And please use this work. This is really inspirational. So thank you, everyone. Stay safe, take care, and have a good weekend. Thank you.
Thank you.
Bye.